Good afternoon. Welcome to the Wisconsin Health News Newsmaker event with Department of Health Services Deputy Secretary Julie Willems Van Dijk. My name is Tim Stum. I'm the editor of Wisconsin Health News. Thank you all for tuning in today. Julie, thank you so much for taking some time out of your busy schedule today. Thanks to our generous sponsors for making today's Newsmaker event possible. A huge thank you to Anthem Blue Cross and Blue Shield of Wisconsin, Deloitte, Froedtert and the Medical College of Wisconsin, Husch Blackwell, Mayo Clinic Health System, Briesen Roper, and the Wisconsin Hospital Association. Thank you also to Badger Bay Management for helping host our virtual events in partnership with Wisconsin Health News. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial. You can sign up on our website at wisconsinhealthnews.com. Again, we are thrilled to have Deputy Secretary Julie Willems Van Dijk with us today to talk about the state's plan for distributing COVID-19 vaccines. On Thursday, a Food and Drug Administration advisory panel of outside experts is set to review Pfizer and BioNTech's COVID-19 vaccine. If approved, as expected, Wisconsin could potentially see its first doses within a week. The Deputy Secretary, a former local public health officer, is helping lead the state's efforts and how the vaccines will be distributed, a task she has described as the most significant public health undertaking of our lifetime. Her time today is understandably limited, so I want to dive right into the questions and learn some more. So Julie, maybe you could just start by walking us briefly through this timeline. I know that you have stressed, and I'll make a point of it as well, that this is preliminary. No COVID-19 vaccine has yet to be approved by the federal government. But with that caveat, as mentioned, the FDA's Vaccine Advisory Committee is slated to meet this week on Pfizer's vaccine. And some reports have said that if approved as expected, distribution could begin as early as the end of the week. Some Wisconsinites could be potentially getting their first shots by next week. So can you just briefly walk us through maybe a best case scenario timeline for the coming weeks? Once Wisconsin gets that first shipment, which I understand is expected to be about 50,000 doses, what happens then?
Absolutely. So first of all, a couple of things happen at the federal level. The FDA's committee will meet and issue the emergency use authorization. Then there's a second committee, the Advisory Committee on Immunization Practice, often called ACIP or ACIP. That committee meets and sets the clinical guidelines. So FDA says the vaccine is safe and here's how it can be used. And then ACIP says, here's who should get shots, here's who shouldn't get shots, here's the side effects, here's how you mix it, and here's the right dosing, and all of those clinical pieces that vaccinators need to give the vaccine safely. So we need both sets of approvals. And then the CDC will issue all of the associated materials we need to give people who are giving vaccines. So all of the patient information and the consent form and those kind of administrative pieces, and we'll need to train our vaccinators very quickly. So all of that I anticipate will take about a week after FDA issues their authorization. And then the other thing is we have to have vaccine. And so we are anticipating shipment of the first group of vaccines in the next week. And so we anticipate we will have vaccine here. And so I think our best case scenario is about a week after the FDA EUA is authorized, we should be putting shots in arms. But it all depends on all of these factors. It could be a little bit longer, but hopefully within a week or so.
Great. And then due to the unique cold storage requirements of Pfizer's vaccine, it's going to be, as you have talked about, distributed through a hub and spoke model, sent to these regional hubs that have that important freezer capability, who are then planning to send it out to other providers. UW Health and Marshall Clinic Health System said Monday that they are among those regional hubs. Who are some of the other hubs, especially in maybe some of the more rural parts of the state?
Yeah, we have hubs across our 7 HERC or Healthcare Emergency Response Coalition regions in the state. We're not making a big deal of where the hubs are because of security concerns, but what I can assure you is that we have placed them across the state so that we will be able to get this vaccine to all corners of Wisconsin. And that's the real critical piece. It's not where the hub is, it's where the spokes are, and that we'll have a system for getting vaccine out to rural areas, to big hospital and healthcare systems, to small clinics. I know to other healthcare workers like our emergency services personnel, people who work in our federally qualified health centers. There'll be a system for working with our tribal health centers. So it's really the spokes that are the issue, or not the issue, but the strength of the system in getting vaccine everywhere we need it to be.
Great. And then once it gets to these hubs, um, you mentioned they then distribute it. How do they decide who gets it after that? And what's the process for like maybe an independent physician or clinic that's not associated with a health system? How do they get this then?
Sure. So we're using the same system we use for all childhood vaccines for people to order vaccines. So if you are a small clinic and you want to get vaccine for your staff, you will put an order into the Wisconsin immunization registry, just like you would be if you were ordering, measles, mumps, and rubella vaccine or tetanus vaccine. So you put your order into that system, and then we will approve those orders going from a hub to your system. And I think a really important point, Tim, is the hub and spoke is for the Pfizer vaccine because of these cold storage requirements. We are also anticipating that Moderna vaccine will be coming very shortly after that. And because Moderna vaccine can be stored in a normal immunization refrigerator and freezer system, we'll be sending Moderna vaccine directly to those who order it. And so they won't have to go through this hub and spoke system because we'll be able to deliver vaccine directly to requesters.
Great. So these regional hubs were chosen, I assume, as we talked about, due to this ability to have these cold freezers. Has the state itself had to purchase any additional freezers, and how are things with other supplies like vials and syringes? I mean, do you anticipate any issues on that end in these coming months?
Well, the good news is we haven't had to purchase any uber cold freezers because we've have a good system of them here in Wisconsin, and we've had great partnership with parties across the state. I want to give a special shout out to the cheesemakers of Wisconsin who have been offering their assistance with transporting because dry ice is a critical part of cheese making. And, so people are really leaning in and saying, we need to be together on this. So we haven't had to purchase any additional freezers. We know that the vaccine will be coming with the core supplies needed to administer it. So syringes and alcohol wipes and Band-Aids and things like that. We have been working on purchasing additional supplies and providing them to local health agencies and having them in stock here. Things like coolers. You always need coolers for transporting vaccine when you're doing mobile vaccination clinics, and additional supplies to supplement the supplies we anticipate coming with the federal government.
You mentioned the department mentioned last month that it had received a little over $3 million in federal funding for supporting, among other things, local health departments in this process, for bolstering the immunization registry. Is that going to be enough to support these efforts? Is more federal or state dollars needed? If so, how much? And what happens if it is needed if that extra funding does not come through?
Yeah, great question. Good news is from when we announced that, CDC has provided another $2 million to the state. Again, all of this is being focused on the vaccination effort for staffing for vaccination. I think one of the things that is important to remember is that this will also be a service that we can bill your health insurance for. It's a preventive vaccination. All health insurance is required to provide coverage, full coverage without deductible or copay for preventive services. And so we fully anticipate maximizing that as much as possible to bill insurance for the administration fee for these vaccines. The vaccine itself, I want to emphasize, has been purchased by the federal government, so there will be no charge to the state of Wisconsin or to anyone receiving a vaccine. But this is, again, a massive effort. So the staffing and the logistics and the transportation associated with it is all pieces that we are redistributing from across state government. And also we are very grateful that our Wisconsin National Guard has received additional Title 32 orders for federal support of the National Guard through at least March, and have been working closely with the Guard to supplement the staffing for this. And so we will continue to redistribute those resources and evaluate the total need that we'll have as we move forward in our planning for this massive effort.
So you said in a briefing yesterday with reporters that in addition to the extra staffing from the National Guard and other sources, that the state is working on a contract for additional vaccinators to supplement the health systems and public health departments who will take a lead in this, but are strained by the current level of the pandemic in our state. Yep. Could you talk a little bit more about that? I mean, what would this contract entail? Are these non-healthcare workers you're looking at bringing in, or retraining healthcare professionals from other fields? On top of that, UW system has talked about giving tuition credit to nursing students to help with vaccines. Dentists and optometrists are seeking permission to immunize during appointments. Can you just talk a little bit more about the workforce needed to do this, and what type of options are being considered?
Well, you've just described a whole bunch of them, Tim, and I think, I think about this volume. So I mentioned this yesterday too. We have 5.8 million people, and so 2 doses, the 2 vaccines that we have in the pipeline right now both require 2 doses. So 11.6 million doses of vaccine if everyone in the state received it. And that's what we need to plan for, because that is our goal, is for everyone to receive it. And so just to put it in perspective, when we think about how many nasal swabs we've done for COVID-19 so far since last March, we're coming up on 5 million across the state. So that's 6 months we've done 5 million swabs. It's going to take a little longer to do a vaccine probably than a swab, because of this is something we need to teach people about, give them information about side effects, and they need to provide written consent because this is an emergency use authorization. So it's going to take all hands on deck. So similar to testing, we know that half of the tests that we've done for COVID-19 have been done in our healthcare system, and we would anticipate probably about that percentage for vaccine as well too. But we know our healthcare system can't add in 11.6 million doses on top of, they're still going to be caring for people with COVID-19. And so that's where we're looking at supplementing through pharmacies. We've had great partnership with pharmacies in Wisconsin, and we will build on that partnership. They have been excellent in flu vaccine and other vaccination efforts. We welcome opportunity for other healthcare providers, and the contract that we're securing will provide vaccinators to do mass community-based clinics that we will be launching after this first phase. So later in 2021. And we want to make vaccine easily accessible to as many people as possible. And that will be the system that we'll be creating to be able to do that.
Great. So in terms of who gets the vaccine, that first tier is going to be healthcare workers and staff and residents at long-term care facilities. Best case scenario, how long will it take in Wisconsin to get through that first round?
I think it's going to take a couple of months. We're talking about 450,000 healthcare workers. We know right now we're going to have fairly small amount of vaccine coming every week. And remember, it's 450,000 times 2. So nearly 1 million doses to administer. And then similarly with long-term care, we're really appreciative of the federal government's contract with CVS and Walgreens, and those companies will be administering the great majority of doses to our citizens who live in long-term care facilities and the staff. But with a 2-dose series, it's at least going to take a couple of months. Now, what I don't know is when will we start phase 1B? Will we wait till phase 1A is done before we start phase 1B, or will there be some overlap of them? That is still some of the planning assumptions that we're working on, and part of, again, will be contingent on decisions from federal partners, including prioritization decisions about who's next, and also vaccine supply. We can't go any faster than the vaccine is coming into the state. And so that will be something, just like we saw with testing, that there were times we had no tests available, then we had a few tests available, then we had lots of tests available, then there were supply issues and we'd have a slowdown. I anticipate we'll see similar things with vaccine, that it will ebb and flow a little bit, but we will get through our whole population in the months in 2021.
And then talking about following up on prioritization, so that that next tier when it starts could be pretty big. The essential workers and residents over the age of 65, especially depending on how you determine essential workers.
Right.
Can you talk about just some of the factors that will be determined and how to prioritize that next tier? I mean, for example, how do you decide if a grocery store worker gets the vaccine over a 66-year-old retiree?
Yeah, these are really tough questions, aren't they? And so that's why I'm not going to make them on my own. That's why we're relying on good counsel from esteemed groups like the Advisory Committee on Immunization Practice. This is, this is not a committee that was created for COVID. This is a committee that functions year-round every year to help sort out vaccine questions. And then our State Disaster Medical Advisory Committee, who has been advising us since the beginning of the pandemic on considerations for how we distribute limited resources during this pandemic. So clearly some of the things that they think about is, as they make these decisions, is who is most vulnerable, who is at most risk for most severe illness. That's certainly a factor. Another factor is who is at most risk for exposure to the disease based on their job, their requirements of their job. And then who have we seen over the pandemic who has been most affected by this pandemic? And, that has close relationship with who's most at risk, but, who has borne the burden of this? And I think those are all principles that those committees will be looking at and providing counsel and recommendation to the Secretary's office to advise the governor, and will make decisions. The good news is there is going to be enough vaccine for everyone. So this is not like whether you get a vaccine or you don't. It's just a matter of how quickly you get it and where you are in line. And I think I encourage all Wisconsinites to be patient on that front. And I have to say this, Tim, in the meantime, this is going to take 6, 7, 8, 9 months. And so we all need to keep fighting COVID in the meantime. COVID is still going to be among us while we're getting ready to do vaccination. So we need to mask, need to social distance, need to keep our social circles smaller until we reach a point with enough people vaccinated to move forward.
And then once someone does get that vaccine, what happens then? I mean, are they kind of free to go out amongst the world and maybe not wear a mask as much, not social distance as much? What happens when someone does get that vaccine?
Well, I would say I wouldn't just go free as a bird right away when you get the vaccine. First of all, it takes time to develop immunity after you get the vaccine. And remember, it's 2 doses. So we don't consider you with full immunity until at least a couple weeks after that second dose. So there's already, a 4 to 6 week period of time in there for you to develop immunity. And then secondly, no vaccine is 100%. And so you want to be careful about your continued infection control protection while lots of the rest of the population still may be transmitting to you, and you don't know exactly how you yourself responded to the vaccine. So yes, I think it will provide us with the opportunity to start loosening some of the requirements for people who have been vaccinated. But until most of us are vaccinated, I would encourage people to still be prudent. And let's also remember those same protective measures protect you against other communicable diseases like influenza. And so wearing a mask when you're out in public might not be such a bad thing to do as a normal course, even after we're all vaccinated against COVID-19.
Great. Julie, we're quickly running out of time, but I want to end, I apologize to end on a negative note, but I want to end with this last question. I mean, we've talked about some of the different parts of this, the staffing, the supplies. What do you think is going to be in these months ahead, the biggest challenge that the state will face as it distributes these vaccines when they start coming?
Well, certainly a vaccine that has to be stored at minus 94 degrees Fahrenheit is a big challenge. Let's be frank about that. A second big challenge is we're not in control of the supply of vaccine coming to us. And, we just are really hopeful that that supply will keep coming. And a third challenge, I think, is we're balancing, first of all, lots of people who want to be first in line, but also balancing those who may not be sure about this vaccine yet. And so we want to continue to provide people with information about the safety of the vaccine. We want to be as transparent as we can be with people. We'll want people who receive the vaccine early to be able to let people know how their experience was. And so it's continuing to maintain the momentum that people want the vaccine. And then finally, that we all be diligent, that COVID will still be amongst us, and we don't let our guard down until we start to achieve levels of vaccination that will secure herd immunity across our state.
Great. Julie, thank you so much for taking some of your valuable time today. Thank you to all of you for tuning in today, and thanks to our generous sponsors for helping make today's virtual event possible.